than 50 places in England have seen a rise in coronavirus cases. New data has figures from Public Health England show that 17% of local authorities are reporting an increase in new COVID infections. This time last week, just 16 areas were recording a rise in cases, with Newark and Sherwood in Nottinghamshire the worst of. But the latest report from PHE for the 7 days to February 19 shows that 52 of the 315 local authority areas in England have seen a rise in the areas where cases are rising the fastest include Rutland, East Mids, up from 135.2 to 240.4, North Warwickshire, 176.2 to 234.4, Gosport, Hants, 107.3 to 145.0, and Craven, North Yorks, 42.0 to 77.0. Corby in Northamptonshire continues to have the highest rate, with 249 new cases recorded in the 7 days to February 19, the equivalent of 348 cases per 100,000 people. This is up from 315.7 cases per 100,000 people in the 7 days to February 12. Peterborough has the second highest rate, up slightly from 264.0 to 270.9, with 548 new cases. Middlesbrough is in third place, down from 322.0 to 267.4, with 377 new cases. The 52 places where COVID cases are rising. The latest update of COVID-19 case rates for every local authority area in England shows 52 places have recorded a rise in the last. The figures, for the 7 days to February 19, are based on tests carried out in laboratories, one of the government's testing program, and in the wider community. The rate is expressed as the number of new cases per 100,000 people. Data for the most recent 4 days, February 20th to 23rd, has been excluded as it is incomplete and does not reflect the true number of. Rochdale, 171.3, 381, 183.4, 408, Chesterfield, 163, 0, 171, 179.2, 188, Hyndburn, 129.6, 105, 159.2, 129, Fareham, 118, 7, 138, 120.4, 140. Parts of Devon are still recording the lowest case rates, including West Devon, Torridge and the South Hants. The figures have been calculated by the PA News Agency using data from the government's coronavirus dashboard published on February 20. They are based on tests carried out in labs and in the wider community, and the rate is expressed as the number of new cases per 100,000. Data for the most recent 4 days, February 20th to 23rd, have been excluded as it is incomplete and does not reflect the true number of cases. It comes after COVID cases in the UK rose by 8,489 yesterday, the lowest the figure has been since the start of October. The number of new infections recorded on Tuesday was smaller than it was last Tuesday, 10,600. It is also the lowest daily rise the nation has seen since October 2nd, when 6,968 new cases were. A total of 4,134,639 have now tested positive for COVID in the UK since the start. Meanwhile, separate new figures out today show that most adults in England are continuing to limit the number of socially distanced contacts they have with others, despite the current lockdown entering its second month. A majority of adults reported either no socially distanced contact with other people, or socially distanced contact with between 1 and 5 individuals. In the latest survey from the Office for National Statistics, the figures are based on responses collected from people in private households from January 26th to February. They also show that around 4 in 5 adults reported no socially distanced contact with anybody outside their household aged under 18 or 70 and over in the most recent. It comes just days after the Prime Minister set out his 4-stage roadmap for easing lockdown, which relies in part on infection rate. Outlining the key stages in the Commons on Monday, Boris Johnson said, "At every stage, our decisions will be led by data, not dates, and subjected to first, that the vaccine deployment program continues successfully, second, that evidence shows vaccines are sufficiently effective in reducing hospitalizations and deaths. Third, that infection rates do not risk a surge in hospitalizations which would put unsustainable pressure on the NHS. And fourth, that our assessment of the risks is not fundamentally changed by new variants of COVID that before taking each step we will review the data against these tests, and because it takes at least 4 weeks for the data to reflect the impact of relaxations and restrictions, and we want to give the country a week's notice before each change, there will be at least 5 weeks between each. In the first step of the roadmap, all pupils in England's schools are expected to return to class from face masks and testing, and second, socializing in parks and public spaces with one other person will also be permitted from that date. A further easing will take place on March 29, when the school Easter holidays begin, with larger groups of up to 6 people or 2 households allowed to gather in parks and gardens. But progressing along the schedule will depend on meeting 4 tests, the success of the vaccine rollout, evidence of vaccine efficacy, an assessment of new variants, and keeping infection rates below a level that could put unsustainable pressure on